The role of the relationship in psychotherapy is basic to any and all impact that the therapist has on the patient that comes to their door. To that end, the therapist's essential humanness must be shown from the first moment on throughout the course of therapy. The therapist must be known to the patient, biographical information withstanding. No one reveals themselves or engages in an intimate relationship with a blank screen. The therapist must be respected by the patient for their honesty and their integrity, and for their commitment to the patient and to the patient's process, both their self-revealing and their resistance. This understanding happens on the patient's part as they slowly test the therapist on a conscious and unconscious level. And as the therapist passes the tests, or most of the tests, a sense of safety begins to grow on the part of the patient, and an increased sense of involvement develops between patient and therapist. Trust develops over time. Therapists must be available and non-defensive for both transference reactions and real confrontations of their character by their patients in a here and now process. Patients must see that their strong emotions are welcomed by the therapist, and that the therapist joins them when necessary in looking at his or her own character as well as the character of the patient. Therapists must be able to acknowledge their errors and their character issues when necessary in order to further the relationship and to role model honest self-exploration. Patients must see over and over again the process that the therapist is inviting them to engage in. With the freedom to test the relationship and a mutual non-acting out contract in effect, patients are able to come closer and develop a more intimate relationship than they've ever had at any time in their lives. As the development of the relationship, the sense of safety grows, patients walk slowly and more readily towards fearful and shame-laden material.